Welcome to today's video, where we'll be diving into a rare but fascinating heart condition, cardiac lipoma. We'll explore what it is, why it happens, how it affects the heart, and what can be done about it. So, let's get started. The exact cause of cardiac lipomas remains largely unknown. Most are considered to be benign neoplasms, meaning they are non-cancerous growths. Some may represent hamartomas, which are disorganized masses of normal tissue. Genetic factors or developmental anomalies during fetal development may play a role in rare instances, but further research is needed to understand the precise origins of these growths. Cardiac lipomas are essentially benign fatty tumors that grow within the heart. As they enlarge, they can interfere with the heart's normal function. This interference can manifest in several ways. The tumor may obstruct blood flow, compress surrounding heart tissue, or disrupt the heart's electrical conduction system. Depending on the location and size, this disruption can lead to a variety of symptoms and potential complications. Cardiac lipomas are considered very rare, making it difficult to determine their exact prevalence in the general population. They are found incidentally during imaging studies performed for other reasons or during autopsies. Due to their rarity, large-scale epidemiological studies are lacking, and much of our understanding comes from case reports and small case series. The signs and symptoms of a cardiac lipoma can vary widely depending on the size and location of the tumor. Some individuals may experience no symptoms at all, while others may present with a range of cardiovascular issues. Common symptoms include chest pain or discomfort, shortness of breath, palpitations or irregular heartbeats, lightheadedness, fatigue, and in severe cases, even sudden cardiac arrest. The variability in presentation underscores the importance of a thorough cardiac evaluation when these symptoms arise. Diagnosing a cardiac lipoma typically involves a combination of imaging techniques. Echocardiography, using sound waves to create images of the heart, is often the first-line investigation. Cardiac magnetic resonance imaging, or MRI, is considered the gold standard for confirming the diagnosis. MRI provides excellent soft tissue contrast, allowing for clear visualization of the fatty mass. In some cases, computed tomography, or CT scans, may also be used, especially if there are concerns about calcification within the tumor. A biopsy is rarely performed due to the risks involved in accessing the heart. Cardiac lipomas aren't typically classified into distinct types like some other tumors. Instead, they are primarily characterized by their location within the heart. They can be found in the atria, ventricles, or within the pericardium, the sac surrounding the heart. Their specific location plays a significant role in determining the symptoms they cause and the appropriate treatment approach. The management of cardiac lipomas depends on several factors, including the size, location, and whether the tumor is causing symptoms. Asymptomatic lipomas may be managed with watchful waiting and regular monitoring with imaging to assess for growth. Symptomatic lipomas, or those that are growing, may require surgical removal. Surgical resection is typically performed via open heart surgery, and the goal is to completely remove the tumor while preserving normal heart function. In cases where surgical removal is not feasible due to the tumor's location or size, other interventions such as debulking may be considered. Careful consideration of the risks and benefits is essential in determining the optimal treatment strategy. Since the underlying cause of cardiac lipomas is largely unknown, there are no specific preventative measures. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, is always beneficial for overall cardiovascular health. However, these measures are not specifically targeted at preventing the development of cardiac lipomas. The prognosis for individuals with cardiac lipomas is generally good, especially if the tumor can be completely removed surgically. However, the long-term outlook depends on factors such as the presence of other underlying heart conditions and the completeness of the resection. Recent research has focused on improving imaging techniques for early detection and developing less invasive surgical approaches to minimize the risks associated with tumor removal. Further research is also needed to better understand the genetic and developmental factors that may contribute to the formation of cardiac lipomas.